Healthcare disparities between African Americans and Caucasians and how their treatment, care, and resources are not the same. This report was prepared for Professor Gary Abels, Grand Rapids Community College. I am a student here. My name is Marika. I am in the BA Business Communications course here online with Professor Abels. Injustice anywhere is a threat to justice everywhere. We are caught in an inescapable network of mutuality tied to a single garment of destiny. Whatever affects one directly affects all indirectly. Martin Luther King Jr. So healthcare disparities amongst African Americans and Caucasians have become more relevant to the open public as it has become more apparent that amongst these two groups, the use of resources, care, and treatment provided are not equal. And the purpose of this study is to look at both groups and examine the differences that are being displayed. We will look at the past 5 to 10 years and their treatment, care, and resources and how they're unequal. I'll also look at has the problem increased or decreased? Why are these disparities becoming more public knowledge? And has there been any change in these disparities? So the scope of this study, again, is to just look at the two groups and to see the differences in how there's inequality in healthcare. It has become more of a social media outlet to now that public is being more notified of these issues, which are causing the healthcare system to be more conscientious of how they are treating these two groups. So some definitions that will be called out here throughout this report. Healthcare, of course, is the prevention and treatment of diseases through medical professional services. The Hippocratic Oath, it's an oath of it's an oath of ethics historically taken by physicians to treat the ill to the best of one's ability, to preserve a patient's privacy, and to teach these secrets to the next generation. It's an invaluable moral guide. Treatment, it's the medical care given to a patient for an illness or injury. Resources, when it comes to healthcare, are defined as materials, personnel, facilities, funds, and anything else that could be used in providing healthcare services. Disparities is a condition of being unequal. It's a noticeable difference that one is being treated unfairly, and economic disparity that exists amongst ethnic groups. So the methods of these procedures and how I found my research for my report, I used Google, being in the Grand Rapids Community College, the Grand Rapids Community College Library. I have also worked in the healthcare field myself for the past 20 years, so I'll be able to give you a little bit of a personal insight on that piece. So let's look at some findings. So with care and treatment, the resources that are different amongst African Americans and Caucasians. Why are African Americans sicker than their white counterparts? I have been in the healthcare field again for the past 20 years. I've done inpatient care for the past 8.5 years, and I have seen where some providers or even nurses that are caring for African American patients, and when they come through the door, they think that they're just there for pain medication. They're not really looking at the fact that, okay, if this patient is stating they're in pain, let's try to figure out the source of the pain. I've even worked with a nurse who came into the break room complaining about her African American mother of 5 at the time. And, she was just thinking that the patient really wasn't sick and that she was only there for a vacation because she had 5 kids. I knew the patient. She didn't know I knew the patient. And I did let her know I personally knew that patient outside of work. And she wasn't there for a vacation. She actually had been having some health issues that stem from birth, from childbirth. So it was quite unfortunate. She kind of put her foot in her mouth with that one. But it's just the world that we do unfortunately live in. So some research shows that treatment care and resources dating back to 2005, according to the National Healthcare Disparities Report, that white patients receive better quality of care from African Americans. And according to the State of Research on Racial Ethnic Discrimination, excuse me, and the receipt of health care in 2012, the percentage of white patients were 53% opposed to 43% of African Americans when it came to quality of care. That's a huge difference, even if it's just 10%. Anything above zero it's a lot. So Shavers also mentioned that under the national poll of the U.S., that some of these resources that are available show a significant difference among these two groups. Some examples include screening for hypertension, cancer, mental and physical health, as well as healthcare coverage. So just for a little example, when it comes to taking care of a patient, Judge Glenda Hatchett, who was an African American woman, her daughter-in-law went in to give birth to the baby at 2:48 p.m. and she started to have and complain of some issues. The nurse did not notice any bleeding until around 5 p.m. in the patient's urine. She never notified the doctor until 11:25 p.m. that night, and unfortunately the patient died at 2:22 a.m. the next day. Come to find out, she had some internal bleeding. So why wasn't the doctor notified at the time that the nurse noticed the bleeding? It's unfortunate. So if we look here at figure 1, the rate of African Americans mobility rate in pregnancy and childbirth related causes, Black women are 243% more likely to die from pregnancy and childbirth related causes. And also just taking a look at 22% more likely to die from heart disease than a white woman, 71% more likely to perish from cervical cancer. So again, another screening method that, we can screen for cervical cancer, screening for heart disease, again, hypertension, heart disease, cancer, things like that. That could really save some lives. 243%. That's alarming. So here's just a picture of Judge Hatchett here and her son and the daughter-in-law with the baby, which was unfortunately, that's just an unfortunate incident that she died within 12 hours of giving birth to her baby. So when it comes to treatment and healthcare, there just needs to be workplace competency. There needs to also be a systematic change to ensure that race is erased and that care is top priority. Of course, we can't completely erase race. However, when we do come in and we see a patient, skin color should not be a factor. The best way to ensure across the board that both African Americans and Caucasians, again, are provided the same type of care with both groups, no matter, is again to just education, competency. This will help, in that bridge that gap with healthcare. Let's see. So Yearby stated that structural racism prevents African Americans from obtaining equal access to resources, wealth, employment, income, and health care, which are the cause of some disparities in health. So let's look at this figure here, figure 2, which is the health and healthcare for Blacks in the United States in 2019. If you just look at some of these numbers, there has been some decline, of certain things here. However, if you look up here in this area with income, low income, there's a little difference there. When you're in a low income area, you're just not really afforded the type of health care because you're low income. So that means you're probably more than likely some patients or some people in the low income area are placed on some form of Medicaid, and a lot of providers or facilities do not always participate with Medicaid. So that's a real struggle with them making sure that they get the proper care that's needed, or even the amount of additional resources that are available if that facility or again provider does not carry their coverage, which causes some mental and disparities, stress on that patient, having to pay co-pays. So some resources here. The impact of the African American community in terms of resources, especially again looking at that low income area, affording the high quality care as Caucasians. Some of the factor could be again having access to specialists, paying for medication, your co-pays. Even though some Medicaid patients have a zero copay, if they need to be referred over to a specialist for any type of additional care for a disease or diagnosis, that specialist may not take their insurance. So that's a gap. So having adequate health insurance does play, again, a role in available resources. Again, let's go back into having that Medicaid plan. It's just, Medicaid is a government-funded insurance company. So if you're on any type of government assistance and you don't have health care, a lot of patients do obtain Medicaid, and there's different products to that. They can have either Meridian Medicaid, you have Priority Health Medicaid, just to name a few, and some hospitals excuse me, some hospitals and providers just don't participate with that insurance. So if we look at the lack of healthcare coverage, it's one of the leading disparities in the African American community. Adults at 11.5% of African Americans are without health care, opposed to only 7.8% of Caucasians that have gone without health care coverage. And the lack of health care coverage is one of the leading disparities in the African American community. Again, that's 7.8% of Caucasians to that 11.5% of African Americans that have gone without health care. Patients they become frustrated. I have so many patients who are on low income, they're African American, and they cannot afford transportation. They can't afford transportation. They may not even have a car. And then if they need to catch the GO bus, a lot of times the GO bus doesn't go to certain areas. So then you have to look at other factors, trying to pay for their medications. Some medications are extremely high. If you're on a blood thinner, for example, Xarelto, it's $98 for only a 30-day supply. So a lot of times you can get help with coupons, you can get a free 30-day, but it's not continuous. So again, having those available resources available is a huge factor in care for patients. So with public knowledge, a lot of patients are going to social media, especially Facebook, Instagram, Twitter, and just expressing their concerns of what's going on. It could be during their hospital stay, outside of their hospital stay, and they're actually calling out these facilities or providers and how they're being treated differently due to their skin color, which is unfortunate. It's just a huge unfortunate deal there. If you do have time later on, please look up Henrietta Lacks. She is an African American woman who was diagnosed with cancer. Upon her death, her cells were used for medical research. Her family was not even aware. Rebecca Stobo. She is an author who actually wrote a book about Henrietta Lacks after being in a biology class and her teacher mentioning Miss Lacks and knew little information about her, which caused Rebecca to start her research into Miss Lacks' life and worked with her family to get more information. And now, well, recently, a few years ago, Oprah Winfrey even played Henrietta Lacks in The Immortal Life of Henrietta Lacks. So, check it out. Good book, good movie. Good movie. So we just look at some percentages here of social media users. Just looking at 2021, an estimate of 225.6 million users are using social media. So again, there's that public knowledge factor there. So just in summary, the cure for disparities will be to, again, increase treatment and care and resources in preventable diseases and illnesses. We can no longer ignore the fact that unequal treatment is being displaced between these two groups, African Americans and Caucasians. The best thing to do is to educate providers and those that are caring for patients on how to care for different races, having a diverse workforce, because once we work with different ethnic backgrounds or, working with different cultures, we're able to work with each other to help care for these patients. And having that diverse organization, making sure that competencies, education is set up to just kind of help. I know that we have competencies here in my organization just to help, even with obese patients, some of the things not to say. How can you help them? So, it's just all based upon that. It's unfortunate, being Black in America is a risk, but we should be able to work together to care for each other. There should be no inequality when it comes to healthcare, because we healthcare providers and the system as a whole is here to treat everyone. We shouldn't see a skin color when it comes to treating patients. I hope you enjoyed this report. Any questions or concerns, just reach out to me. I thank you.